For most rotator cuff tears that occur in the absence of a specific trauma, we typically start with physical therapy, anti-inflammatory medications, and possibly a cortisone injection to deal with the pain. So the rotator cuff is a set of 4 muscles that kind of come around the humeral head and grip it and allow it to rotate. They initiate abduction and forward flexion. And without a rotator cuff, your humeral head has a hard time centering on the glenoid, so it's slipping around and not having that stable fulcrum to start rotation. So as a result, you're not able to lift your arm overhead without pain or weakness. So with frozen shoulder, the capsule is kind of scarred, which limits the motion in pretty much every direction. And it just takes time and therapy for that scar tissue to be broken down and to get your range of motion back. Most rotator cuff tears actually occur, I'd say, without trauma. In folks over the age of 60, it's a degenerative process where the rotator cuff just thins over time, and then there might be some inciting incidents such as a fall that kind of completes the tear, and oftentimes that's correlated to the progression of symptoms. In some cases, the rotator cuff was completely normal, and then you'll have a more significant trauma that acutely tears the tendon off the bone. So most patients with rotator cuff tears typically have pain in the shoulder, difficulty sleeping on that side at night, pain that goes down from the shoulder down to the elbow even, and difficulty with overhead activities. Sometimes they can't even raise their arm over their head. So initially, we will examine the patient in our clinic and check their range of motion and strength. And if we think that there might be a rotator cuff tear, we get an MRI, which will show us if the tendon is torn off the bone. For most rotator cuff tears that occur in the absence of a specific trauma, we typically start with physical therapy, anti-inflammatory medications, and possibly a cortisone injection to deal with the pain, as the remaining muscles around the shoulder help compensate for that loss of rotator cuff function. When those treatment options fail, at that point we discuss arthroscopic repair. It's an outpatient surgery that's minimally invasive. We make 4 or 5 1-centimeter sized incisions. We place a camera into the shoulder and we perform a repair through those small incisions. So the recovery is about 6 to 12 months for full recovery. It's about 6 weeks in a sling, after which we'll get them out of the sling and get the shoulder moving, and about 6 months of physical therapy.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate health videos. We upload informative video content every week.